I spent 11,482 francs on my health last year and over 20,000 in the past 2 years. And that's just the direct costs. But I have nothing on paper to prove where I actually stand with my health, which is honestly baffling because I track my finances in great detail, what I earn, what I spend, and how I invest. But the most important thing I own, which is my body, my own health, I never once tracked the way I track my money. So recently, after a sudden death in my family, I was prompted to take a systematic look at my own health. Because despite getting a basic health checkup every year and knowing that there's nothing major wrong with my health, I've been absolutely horrible at collecting and storing my results and at keeping a holistic overview of my health. And now that I'm 34, I realized that this is exactly the age when chronic disease starts to creep in for most people, unless we're careful. So in this video, and as the first step in taking my health seriously, I will show you how I reconstructed which doctors I visited, what checkups I've done, and how much I spent on those visits. And most importantly, I've made myself a health dashboard for tracking all my past and future health checkup results. Until now, all my results were scattered across different doctors and healthcare providers, but by the end of this video, that's about to change. Hi, I'm Ivana. I'm 34, I live in Switzerland, I work in finance, and on this channel, I talk about personal finance, lifestyle, and the things I'm genuinely curious about. So welcome, and I'm glad you're here. If you remember in the first video in this series, I listed the things I think I'm doing well regarding my health and things that I should definitely do better. So if you want to watch that, you can click here. But now, let's start by reviewing my healthcare spending for the past 2 years. As I already mentioned, I've been so bad at collecting my health checkup results, and I don't even remember which doctors I've visited in the past few years. So first, I had to start by remembering who my health insurance provider was in recent years. In Switzerland, where I live, health insurance premiums are growing every year, but the providers are competing with each other. So sometimes you can actually benefit from switching providers and getting a lower premium that way. So in 2022, I was with one insurer. In 2023, I switched to a second one. And from 2024 to 2026, I've been with a third. So the first thing I did was download all the invoices from my insurer's website to reconstruct what I've done in 2024 and 2025. Then I uploaded the files to Claude and asked it to create a dashboard with an overview, and this is what I got. In 2025, my total health spend was 11,481 Swiss francs. Of that, 3,927 was insurance premiums. So basically my basic plan plus my supplementary health insurance. The rest, 7,553, was the actual medical care that got billed. For example, my primary care doctor, other doctors, and lab work. Now looking at 2024, my total spend was 9,355 Swiss francs. So across the 2 years, my total healthcare cost was a whopping 20,837 Swiss francs, all in. And mind you, that's not even counting the supplements, the skincare, the cosmetic procedures, or the sauna I bought for my home. Okay, so now that I've reconstructed my healthcare expenses, I'm going to map out which doctors I visited and for what purpose. The biggest cost in 2025 was my colonoscopy and endoscopy. I did it because I'm very much into healthy eating, and the digestive system is very important for our overall health, because chronic inflammation starts in the gut. So I wanted to make sure that everything is fine with my digestive system. The next big spending item was a lab my doctor uses for my blood work and other tests. But guess what? I never received the results. So I guess that's a good sign that they didn't find anything bad. because otherwise they would have called me, but I would have preferred if they had sent me the results. The next large spending was the CT scan I had at the beginning of the year. The reason for this was that I had pain in my stomach on the left side and nobody could figure out what it was. The CT scan showed that everything is fine with my abdominal organs, but they still couldn't conclude what it was, okay? I think that it was some kind of a tear in the abdominal muscles or tissue, and most likely that was caused by leg pressing too much weight, okay? And no, I know for sure that it's not a hernia, okay? In the end, luckily, it went away by itself, but having such a burning pain in my stomach was really scary. Scary enough that before the scan, I'd already made an emergency ER visit over it. Okay, so that was the next large spending that I have here on the list. And then looking through my other spending for 2025, there's the everyday stuff, a couple of visits to my GP, then I went to a nose and throat doctor, then I went to check my eyes because I was at the optician and he asked me, when was the last time that you saw an eye doctor to check the eye health? And I was like, never, in my 33 years of age. So I decided to go to an eye doctor and check if everything was fine. And at the end of the year, I also had a skin and mole check. And lastly, my gym membership. So it is also counted in here because I can get a small refund back from my supplementary insurance if I have the annual gym membership. Now, going back to 2024, there's more of the same. Basically, I had a gynecologist checkup, I had a thyroid gland ultrasound, I took some iron supplements, and I had a blood work panel done in Serbia before a cosmetic procedure. Okay, so now that I know which healthcare providers I've visited, I'll send emails to all of them asking them to send me my results and medical reports. I've done it once or twice in the past, and I already know that it's not going to be that simple because some of them don't answer emails, okay? Some of them require you to place the request by phone or even to sign an authorization form so that they can send you your results by physical mail. So let me send them emails, and if they don't respond in time, I will follow up by phone. All right, so over the weekend, I sent an email to all the healthcare providers I visited in 2025 and 2024 to request my medical results and reports. Surprisingly, most of them responded. Now that I've received the majority of my results for the checkups I've done in 2024 and 2025, I've also searched my email. I've searched my drawers and health insurance portals for any other older results I could possibly find. And actually, I found many more medical reports, some of them originating from 2012, which is a gold mine, and I'm glad I digitized some of them and saved them. Once I had them all sorted, I loaded all that into Claude, and this is what I've got so far. I've made this dashboard with all the parameters I tested throughout the years. I have here the parameter name, the actual value, reference value, the trend line, and a short explanation of what each of these parameters is. Alright, so now that I've collected almost all the results from all the tests I've done in 2025 and many more from the years before, I saved them in one place, digitally and physically. And I've created this dashboard for easy tracking and comparison. I also made an overview of the healthcare costs to keep track of that as well. Now that I've done all this, I can move on and plan what I should test next based on the biggest health risks for my age, gender, and family history. So if you want to make sure you see it, please subscribe and turn on your notifications so you know when the video comes out. And if you like this one, please give it a thumbs up. Thank you for watching and see you in the next video.